Hi, I'm Dr. Sunny Nakae. We're going to start the question and answer portion of the June 14th session. Many people submitted questions online. We're just going to go through them one by one, and I hope this is really helpful. We'll start with an AMCAS tip. Thanks.
For anyone who's curious about what the UMCAS application looks like, if you're not in the cycle this season, you can initiate an application for free. It costs you nothing. You only pay money if you would like for them to verify it. So if you want to know what's on there, what it looks like, the kinds of information you're going to be inputting so you know how to better keep track of your experiences in advance, go in and initiate an application and check it out. Forewarning, it doesn't save any of the data that you enter. So it doesn't save your transcript information. It doesn't save your experiences and stuff. So it's like you can't work on it as you go because it's so much data, thousands and thousands of applicants per year, that they dump it. And then when you reapply, you have to enter everything again. So if you do decide you want to kind of work on it, save your stuff somewhere else because it'll renew every single year. Okay, so I haven't heard anything back from FAP. Should I keep waiting or just submit my application? If you did the calculator or you're just asking, am I eligible? I would just go ahead and submit. It doesn't cost you anything to submit to the FAP, so it'll be helpful if you're able to just send it out and just see what happens. It's whether or not you want to delay submitting until you hear back from them. I think they're trying to review them as quickly as possible. I think because the process is so expensive, it's worth waiting to see and hear back from the FAP team whether or not you're approved before you apply. But the later on the season goes, obviously you're going to have to kind of make that choice of whether or not you want to get it up front. And FAP does cover secondary applications if the school's policy allows it. So when we get your AMCAS application, we see whether you're approved for FAP or not. And a lot of schools just build into their system to automatically waive a secondary fee or reduce a secondary fee if you're a FAP recipient. Some schools you do have to ask for the waiver, even if you are a FAP recipient. So it's just know what the school's policy is, and then that will move forward. So, okay, so another question is, for COVID, is an August MCAT too late? So a lot of people are August MCATs this year. A significant portion of people applying are waiting for an MCAT. So if you're not going to get your score until September, again, I would submit an application to a school, just one, so that you can get verified. And then when you get your score, I would contact the schools and ask them if it's too late, because it's really going to vary by school, whether or not they're willing to accept or where they will be in their review process. And it might depend on your score at some schools, right? If you got a really high score, there might be, you might call them and say, my score is this, and they might say, definitely. And if your score is middle or lower, then they might say, well, no, we're already working on our, that pool differently. So it can depend on a lot of different factors, how much consideration you get, depending on how late it is in the season. So it's very school specific. In general, schools are trying to be as lenient as possible, but we are constrained by the calendar because, again, offers begin October 15th. The drop date for decisions is April 30th. So we're sort of bound within those windows. We can push it forward only so much, but I would ask for school-specific information about the timing of the application. For UCR, it's certainly not. We're going to do our best to look at everyone, especially if you're from inland Southern California, but other schools, they prioritize their applications very differently. The question from how detrimental is it to my application regarding shadowing opportunities lined up and research? I was hoping, now it looks like I won't be able to participate. So you can list these experiences and the people that you planned on doing them with and just put 0 hours, and you can put on your experiences section. I'm hoping I was supposed to start this in the fall. I'm hoping that I can start this. I may not, it's uncertain due to COVID. And then we will not give you credit for those, credit formally, but we will know that you were engaging and planning on doing these things. And if you are able to send an update later in the cycle to let us know, I did list this research experience with Dr. So-and-so, the lab has not reopened, I'm still not able to, or I was able to get back in and now I'm doing this and blah, blah, blah. So you'll have a way to continue to update schools either through their portal or through just sending an email to like their general med admissions type office. So we know applicants are doing the best. I would lean towards greater honesty. I think we appreciate that more than, well, I'm just going to list it, and if it doesn't happen, then oh well. Like, so if you have a planned experience, list it with 0 hours in your description. discuss your intention, and then give us an update later in the fall when things have fleshed out and you know where you're standing. That's a good question. Let's see. Oh, so should you wait to apply to medical school until you hear back from the FAP? Yes, I think it's depending on your situation, it would be worth waiting just maybe like another week or two. Again, we're not going to be able to read any apps till July 10th. So even if you submitted in early July, the odds that you'll be verified and be ready to go on July 10th are still pretty high. Verification team allows for 6 weeks for verification, but almost never takes that long. So let's see. So will unofficial transcripts be submitted? Unfortunately for AMCAS, unofficial transcripts are not allowed. So you will have to submit official transcripts for verification team in order to get verified. So if you have to do a gap year to account for that so you can get some official transcripts, unfortunately that's a constraint that they're unable to accept unofficial transcripts. I think for obvious reasons, because one of the things that schools pay AMCAS for and participate in AMCAS is to know that all official transcripts are received and verified and they're checking your grades against what you've reported. You are not a reapplicant at UCR if you applied to EAP. They're two totally separate systems, and you can apply with a similar application and use your personal statement and whatnot. Absolutely. Is it crucial to use all 15 experiences? No. Again, it's quality over quantity. So you might have 12 really solid experiences with a lot of longitudinal ones. That's probably better than a bunch of flash in the pan, very short-term ones that are 15. So again, just what is enough? I mean, most people are probably going to be filling out the majority of those experiences and activities. So if you feel like you don't have enough to list, that's something. But if a lot of your experiences are just longer term and you focused on a core, it's really the quality of those things that make a difference to us. And if you've done, a very focused range of activities and you have strong letters from those things, you've shown growth, the rest of your application is good, schools are going to see that and evaluate that holistically. Okay, so what should you change about the application process if you're a reapplicant who was waitlisted? So I think it's important to step back and look at your strengths. How far did you get in the process at the schools that you applied to? And seek feedback from those schools specifically about what you need to improve. And then once they've given you, hopefully they'll give you some parameters, you can focus on those aspects before you turn around and reapply. So sometimes if it's something that you can do, like you need an updated MCAT score, or you need coursework, or it was interview coaching, or depending on what they say the issues were, you may be able to remedy those before you put another application in, or you may need an additional gap year to focus on some of those areas and shore up your application for the next time around. What should your activities and descriptions capture? Is it more about what you did? So I'm a big fan of doing your activities resume style. So that means using action words and describing the activities and the deliverables, not reflecting, right? So we are not so much interested in what you learned volunteering, but like what were your duties if you volunteered at an emergency, foster care shelter or something like that. You cared for children, you cleaned things, you showed up for shifts, you were on call, blah, blah, blah. So give us the description about what you did. And then in your personal statement or your most meaningful reflections, that is about sort of who you are, what you've learned, how you've changed, and why you want to be a physician. So together, they sort of paint a really great picture of the activities that you've engaged, and then the growth and the reflection mainly should appear in either most meaningful essays about that experience, of which you get a maximum of 3 on your AMCAS application, or in your personal comments section of the application. What kind of academic, personal, financial, or career counseling is available to students? Do you mean med students, like current med students? We have all those things for current medical students, a really great, robust program, and per accreditation rules, all of those things have to be available for medical students. The degree to which they are engaged universally or accessible or meet the needs of all students varies by school, but all schools are required to have those things. Typical reasons why a medical school would waitlist or reject you. Lots of reasons. We always have more people than we have seats for. And that is at every single phase. We have more applications to read than we can read. We have more secondary completions. We have more people interviewing than we have seats. So sometimes it's just the year. Sometimes it's specific things. It might be the composition of the class. I mean, in some ways it could be personally related to your preparation. In other ways, it could just be related to how the cycle went that year. That's not incredibly personal. Maybe they're looking at the diversity among undergraduate institutions. Maybe they're looking at the gender dynamic. Maybe they're looking at the local, versus in the Southern California or the rest of California. I mean, you just never really know what multi-factors committees are using to shape their schools. So it'd be good to get some specific information from the school and ask for some specific feedback if they're willing to give that. Let's see. Would getting an MBA benefit a medical school application? Depends on what your deficits are. So if your deficits are in science coursework, then no, because the committee is going to say, well, they succeeded in business school, but we still don't know their capacity to do science. If your overall application just needed to be more focused, more robust, if you needed to show additional engagement, it could be beneficial. But again, you want to tailor your activities to the areas that need to be shored up in order to create, whatever was the problem for the committee could be alleviated. If you were admitted and participated in a joint BSMD program, but left the MD program and received just a bachelor's degree, considered a previous matriculant. That is a school-specific question, but I believe no. I think that if you're in a BSMD, you're what we call a conditional admit. So that means that you don't actually get your seat and you're not reported in the AAMC system as previously matriculated as a medical student. So my guess would be no, but I would check with the school and how the school weighs that. Within the AAMC system, it's a no, because your BSMD is as a contingent. So they don't list you as a matriculant in the student record system, what's called the SRS, that the AAMC holds, until you become a first year. At that point, you enter as a matriculant to medical school. So the school might see it differently, but nationally, you're not considered a previously matriculated student. Typical medical school interview questions. We can do a whole session on interviewing, but there's a lot. Expect questions on growth. Expect questions on personal reflection, your strengths and weaknesses. We do a lot of scenario questions for MMIs related to healthcare delivery or conflict resolution or patient communication. So there's a lot of information out there on interviewing and kind of what you might expect. But we want you to know yourself well, and especially to know your application well. If it's an open interview in a traditional one-on-one, you can expect applications about the school and your fit for the school, as well as your own preparation. So when I used to do one-on-one interviews, I would just look at the AMCAS and I would just say, oh, this person's volunteered for AmeriCorps. I'm going to ask about that. I'm going to ask about leadership because I see they're part of a fundraising thing. So I would, expect a lot of applications about questions about what you've listed in your application. What is one of the biggest barriers that students face in being admitted into medical school? I think knowing the rules of the game is probably the largest barrier. If you don't know, for example, how your AMCAS GPA is calculated when you start college, you might not understand how a poor grade your freshman year can impact your overall GPA. You might not understand that your science GPA is going to be subset out. And I think the second thing would also just be test prep. The MCAT, it's not necessarily the MCAT, it's all the things that you have to do to be successful on the MCAT. And I think we need a lot more test prep and test prep coaching, how to approach the exam. I was actually inspecting campus this morning. 2 of my 4th years are studying for their clinical knowledge exam, their licensing exam. And we were just talking about how the exams are like a game. You got to figure out, it's like a hoop that you have to jump through. You got to figure out how to answer the question in a way that they're asking and what they want the answer to be, not necessarily what you would do, but to think like the exam. So I do think that from what I've seen, and in looking across the pool nationally for the last 20 years, I think one of the rate limiting steps is definitely the test prep, test taking strategies that have to do with the MCAT. And unfortunately, those things continue. So if you are not able to get strong test prep and you just sort of squeak into medical school and you sort of treat the MCAT like, okay, I did the MCAT, now I'm home free. that's not helpful because all you're going to do in medical school is take tests. And then all you're going to do as a licensed physician en route to licensure, as well as to continued board certification, is take exams. So I do think we have to have a growth mindset towards exams. You don't have to be the best test taker in the world, but you need to be a very confident and knowledgeable test taker. Most of the students I work with are smart enough and absolutely know the content. It's the test taking strategies, it's the approach, and it's the confidence that is challenging. So focusing on those things and supporting each other for those things is going to be really key. How safe is it for someone to talk about mental illness on their application if they've accounted for it? This is a tough question. So I'm going to say two things. One, if it's a big gap in your life, you do have to mention it because the committee will pick up on gaps, right? You left college for 2 years and then you come back. We see this gap on your transcript. So you need to be able to address it. How in-depth you want to go about it is a personal choice on how much you want it to be emphasized. I think that we need to destigmatize mental illness. We need to be more forthright about that, and being upfront about who you are and the strengths that you bring based on having conquered or having risen to that challenge. You want to go to a school that's going to support you. So if a school in fact is going to stigmatize your application because of that, it's probably not a school that has the right supports for you in the first place. I've seen an evolution of committees really viewing that as a strength, but you also have to write it in a way that it comes across as a strength. It can't have loose ends. We can't be wondering if you're okay. So I would definitely get advice about how to frame it. And if it's not related to your motivation for medicine, then you don't have to make it central to your application, right? Your application is not an apology for who you are. It is your passion and your commitment to medicine. So where in the hierarchy of your application it sits is important. You could list it in your disadvantage statement. That's a place where people might talk about a chronic illness or a life event that they consider to be a disadvantage within their journey. But overall, I think the general rule is to be as authentic as you can on your application so you end up at a school that is a great fit for you and that has the resources that you need to thrive. If you try to be something you're not, you might end up with a school that is not the right fit for the things that you need. Yes, I agree. We have so many students who have struggled, and we have med students who struggle. Medical students have higher rates of depression and anxiety, and we're now doing mandatory mental health check-ins for our students. I myself have struggled with going through some difficult stuff coming out of last year, and decided like my coping skills are here and I'm underwater. Right? So why do we always wait until we're underwater to get help? We definitely need to reach out and take care of ourselves. If we had a shortage of insulin or we're having other challenges, broken bones, we wouldn't hesitate to get treatment. But for some reason, there's too much stigma, especially in medicine, around mental health. How should you deal with academic dishonesty questions? What can you do? So it's important to understand that there are three flags that appear on your application for three different questions. One is institutional action. Have you ever been subjected to an institutional action by your undergraduate institution? Do you have a criminal history of felony or misdemeanor? And military discharge. So if you answer yes to any of those things, many schools have a process that will route your application into a clearance step before it moves forward in the process. I think of it this way. If we are going to decide that the thing that you have done will disqualify you from being a doctor, we should just disqualify you at the beginning. But if we decide that it's something that you've grown from, it doesn't rise to the weight of disqualifying you, then you should be in the process on equal footing as everyone else, right? So a lot of schools have a similar review process, a separate committee, completely separate committee that reviews it. And if it moves forward, it's asked to be ignored in the rest of the application. So you do have an opportunity to explain an institutional action or a criminal item or military. It gives you some characters. I would write a very straightforward explanation, and the most important part is to take responsibility. So students who write really ambiguous explanations, it leaves us with a sense of uneasiness around whether or not they took responsibility for it, whether they understood the gravity of the situation, and gives us some hints about their maturity. So for example, I read one that was about my lab partner and I, we didn't know the rules. We were collaborating, but we thought it was okay. And so we submitted this stuff and we got in trouble and blah, blah, blah. So we didn't know the rules. It wasn't our fault. No, I failed to pay attention to the rules for the lab and I wrongly collaborated with someone. It was not my intention to cheat, but in fact, that was against the rules, right? So how you write it and whether you take responsibility for it is important. Generally, we forgive minor instances of academic dishonesty. We almost always forgive academic probation. I clear those in 2 seconds because you're already being held accountable for academic probation on your transcript. So whether someone if you're just getting, kicked out or you have to go on leave because your GPA falls below a certain level, I already can see that and I just push those forward, no questions asked. Ones that are tricky for us are interpersonal violence and substance abuse. One drinking underage violation early on, if you're in a state where marijuana is legal and you end up with marijuana on your campus, more than one, then I wonder if you're a knucklehead and are you learning either? And one of our deans used to say, are you too stupid to not get caught or are you just breaking the rules? Both of those things are bad. He's like, if you're gonna do it, at least don't get caught. So multiple instances of the same thing concern us. And of course, interpersonal violence and dynamic also concern us pretty greatly. But we definitely will look at that as holistically as possible. And again, if that's your situation, I would seek some guidance about how to present it. If you do not disclose an institutional action or a criminal item and it is found later, the school has the right to dismiss you. Because the AMCAS agreement requires that you be honest on your application and you attest to that on your application. And so you will be, subject to whatever disciplinary action the school might have, either for applicants or for current students if you're found to have not been honest on your application. Do we look at applicants with multiple MCAT attempts? We do. Most students take the test at least twice. So if you've taken it twice, we don't blink. We're starting to see even 3 attempts because the test is offered so many more times and it's less restricted than it was before. Each time you attempt the MCAT, it's important that you think about what went wrong and what you're specifically doing differently to get a different score. So if you're just going to keep throwing spaghetti at the wall and see if it sticks, that is not the right approach. And that can scare committees because it's easy to amass 4 or 5 attempts that are all within the same range or even not showing any progress at all, and that scares committees. It depends on how far spaced apart the exams are. It depends on what they initially were, what the current scores are. Some schools will give you a super score across the highest in each section. Some schools will average. Some schools will just kind of look at the range of your scores and try and determine. So it's used very differently, but in general, if you have to take the test again to improve your application, you have to take the test again. I mean, that's just the situation that you're in, right? So worrying about how schools are going to view it shouldn't be the focus. What you should think about is how to then do something differently than you've done before. Do you need to study differently? Do you need to work with a coach? Do you need to, work on the sections that were the most, where you didn't feel like you got the score that represented your knowledge base in that area? So we do not necessarily penalize people for multiple attempts, but it depends on the context of all of those scores and how we can look at that in the rest of your academic preparation as well. Any medical schools I would recommend to underrepresented students? I would, obviously ours, we're almost 50% underrepresented students. We aspire to be a very supportive environment for everyone, not just underrepresented students. We recently appointed our senior associate deans for education and student affairs have committed to an anti-racism thread in our curriculum. The students, we did a town hall and the students asked for that. We thought it was long overdue. We have aspects of health disparities, but we haven't been proximal to anti-racism the way that we should have been. So I would look for signs of consciousness on a school's website or when you have conversations with students. Is this a school that is committed to anti-racism, right? Not just are we going to learn about health disparities, but are we going to actually say that health disparities are a consequence of racism? Are we going to talk about racism and violence as public health emergencies, right? So sometimes you can try to assess that based on the school's website, what their curriculum looks like, talking to current students, but your best bet is to talk to current students who share aspects of your identity and find out, are they being supported? How do they feel? No school is going to be perfect. Even the school I came from, Loyola, which is wonderful, has its challenges. Things change over time. So I think it's really important just to talk to the people who are at that school to try and assess whether you think it would be supportive for you. Let me stop the chat for a second and just make sure I check the questions from the form. Let's see. One of the questions that came in was, if you decide to do a master's, does the admissions committee still want letters of recommendation from undergrad? In general, no. So we're fine accepting letters of recommendation from your most recent coursework. And if that's a post-bac or a master's program, totally fine with us. In fact, someone who taught you 6 or 7 years ago probably isn't going to be able to give us as good of a picture of who you are as a student today than a person from your current master's program or post-bac program. Someone asked about extracurricular activities. I'm going into a post-bac program. Should I keep doing some of the things I was doing in undergrad, or what are the activities that schools like to see? And I put this in my book, but the magic ingredient for this is to start with passion. What are your talents? What are you good at? What kinds of things could you engage to make the world a better place given those passions? So I just had a conversation with a reapplicant this week, and I said, well, what do you like to do? And he was like medically related? And I said, no, like, what do you actually like to do? He said, well, I like to play drums. And I knew that he spoke 3 languages from his application. He talked about his community, his parents are immigrants. And I said, okay. And he also had volunteered with hospice. He wasn't able to continue doing that. And he also said he really liked to read. He's really good at like doing things for long periods of time. He has really great long-term focus. So we brainstormed and thought, what about a reading program? What about a companionship program? Elementary school that needs kids, people to read to kids over the breakfast in the morning. Could he help people who are trying to pass the citizenship exam? Could he do online tutoring sessions for people who are working on the TOEFL? How could he use language skills, his love of reading, his love of music to give back to the community in some way that's meaningful? Right? So rather than thinking, well, I have to go and find these experiences that committees are going to like, he should be thinking, what are the gifts and talents that I have, and how can I apply those to make communities better? How can I lift people who are marginalized in some way or underserved in some way and serve those folks? So choose activities and things that you love that involve your gifts. And if you love football, go coach football. If you love music, give some free music lessons, or bring music into a community in some way. I've had students play their instruments at memory care centers, or veterans nursing homes, or senior companionship type things, adult daycare centers or respite care centers for people who have children with developmental disabilities that might have respite care for a couple of days. So there's a lot of things that you can do to give back. And I recommend just thinking about where your gifts are and applying those to make the world a better place. How do committees view, we talked about that. How do you feel? We talked about that. What are some ways to pay for medical school if you're undocumented? And do MD, PhD programs consider DACA students, and do they receive the same funding? So if you are undocumented and you're in California and you qualify for state funds via AB 540, you would qualify for need-based aid through the UC system. If it's a private institution, typically it's loans, grants, and scholarships. Private loans for which you typically need a cosigner who is a US citizen or a permanent resident. MD, PhD programs do provide funding for undocumented students. It depends on whether or not the school is able to have some spots that they fund with school money versus the NIH program, which is called MSTP, Medical Scientist Training Program. That one is federally funded through the NIH, so there are some restrictions on DACA for those funds potentially by school. But I do know 4 MD, PhD students who are undocumented, so I recommend connecting with Free Health Dreamers and phdreamers.org and connecting with those students who are, one of them is actually going to be starting this fall. There's 2 at Loyola, and I think 1 I don't remember the other institution, but there's students that have navigated that. So I do recommend speaking with them about their funding, but there are opportunities there. And it is great because MD PhD pathways cover all the tuition and fees and give you a living stipend for the entire duration of your medical education and your PhD. Should a student with DACA bother applying to medical schools whose website doesn't specify if they provide financial aid? I do think that you have to be savvy, especially if you have the FAP and you have a limited number of applications. I would reach out to the schools and find out if they have matriculated any students with DACA, how their financial aid works, because you do want to focus your energies where your path is viable from the beginning to the end. That said, students have knocked on a lot of doors, and just the act of applying gets your application under committees' noses, and that has opened more doors for students and inspired more schools to find ways to support undocumented students. So I think it's a little bit of both. Like, you have to be pragmatic, but also I would say, like, don't be afraid to go for it unless you get like a super hard no from the school. Consider applying, and if they really like your application, maybe someone will work hard to, you know, find a way for that to happen. If you're undocumented, you can still fill out the FAFSA and for the aid calculation, or the school might have its own specific equivalent to the FAFSA. In California, we have the DREAM application that's equivalent to the FAFSA that will do your need-based aid calculation, but that's a question for the financial aid office at the school. If they're not familiar with how to help you, just be aware that there's going to be a lot of capacity building that might have to take place in order for the school to be prepared to support you for those 4 years in helping you navigate that with private loans and grants and scholarships and whatnot. And things that you should look for in a school as a DACA applicant. I have a whole chapter for undocumented students in my book for this very reason. And I do think that the support for underrepresented students, it's really critical, but for undocumented students, I think it's that next step of intensity, simply because the situation that you're in, particularly we're going to see this court case being decided in a couple of weeks, you don't want to be at a school where you don't have people in the administration who are allies, who are going to stand up for you and make sure that you're taken care of, and that the school does right by you that whole way through. So looking for supportive administrators, you know, people who are directly involved in your medical education and who are decision makers, who control resources to be going to bat for you is going to be really important. So where students have matriculated in the past is a good place to start. And then just making sure that you have those conversations with the student support people about, you know, do they have the tools and resources that you're going to need to be successful? Is it recommended to get a letter of recommendation from one of your most meaningful experiences? In general, letters should help us to complete the picture of your candidacy. So if you have a significant experience that was very meaningful to you and you spent a lot of hours doing it, and it seems that it would lend itself to getting a letter of recommendation and you don't have one, it might raise an eyebrow or two with the committee. If the rest of your application is really strong, we might wonder why you didn't get a letter, but it's not going to be like a automatic, you know, no. But in general, I do recommend seeking letters of recommendation for significant experiences in your application in general. It doesn't necessarily have to be tied to your most meaningful experiences that you might list in the AMCAS. Some things that are most meaningful may not lend themselves to letters of recommendation. If it was something that you listed as, you know, just, you know, you were volunteering at a hospital, like a person may be able to say, yes, you know, Sunny volunteered, we logged her on her time card for, you know, 200 hours or something, but they may not have actually supervised you or seen you in action. So we do understand that there are some parameters sometimes that keep applicants from being able to get, you know, letters around those experiences. But in general, you do want to put on your sort of committee hat and think about how your application is going to be viewed by a committee member. If you've been in the lab for a really long time and you don't have a letter, sometimes we kind of wonder, like, why wouldn't the student have a letter from an experience like that? So try to think about it from the committee's perspective and what ways you can bolster, you know, your application. How do schools look at community colleges? This is something that I think is changing. When I first started in medical education 20 years ago, there was sort of a stigma around community college pathways. Now we're starting to recognize how important those pathways are for access to higher ed. I know medicine's a little slow to the game, forgive us, we're a little slow. I've always known how important those pathways are, but I think medical schools have had a history of thumbing their noses. It varies by state, and it varies by medical school. In general, in California, I think we specifically have initiatives at the UCs to matriculate from our community colleges to increase, college access from that pathway. So at UCR, I can tell you that we actually think that it's a plus if someone, as a transfer student, and because that's a very difficult and challenging journey to begin at a community college and then transfer with advanced standing and have to jump into, a four-year university with advanced standing. So we definitely consider it to be just part of someone's academic journey. It's not something that's looked down on. But it might be something to find out from schools. Do they say anything about community college students or transfer students? Again, if that's been your path, find a school that values it rather than worrying about how it's going to be seen. Apply to schools that are going to value that part of your journey. Hoping to take a summer class. A lot of internship opportunities fell through. I was informed this is frowned upon by medical schools. We are fine with summer classes. Any classes that you take for course credit that you receive on a transcript, you can send in to contribute to your AMCAS GPA. We understand that people do different things in the summer because they might be relocating or leaving their main four-year college campus and going back home. So where we sometimes frown is if you are enrolled at Stanford in the fall and you take a organic chemistry at Redwood City College during the fall semester when you should be at Stanford, then we raise our eyebrow and go, why are you taking a community college class concurrent to your enrollment at your four-year university? So that's the grade shopping approach that can be frowned on, but summers, everybody does summers somewhere else. And sometimes people do it because it's cheaper. One of my students who graduated from USC, actually he was the one I was talking to this afternoon, he had to do an organic chemistry series because he was a non-science major and was like, I got to take this chemistry. And it was $6,000 at USC to take those two classes that he needed for the summer. And so he went back to San Bernardino and took them at CSUSB, and it cost him like $400. So committees understand that. I mean, we get it. And you still did it at a collegiate level. It's completely fine. We know that applicants do the best they can with what they have. And so I would just apply that, do the best you can with what you've got, and how schools view it is going to be up to them. How are you seeking clinical experiences during COVID? What counts as clinical experience? This is sort of changing. So we want you to have exposure to patients, right? Patient exposure, meaning, do you actually know what the healthcare environment is like? Do you understand the role of the physician? Do you understand this thing called bodily fluids and sick people? Well, I don't do that, but it would be good to know, right? Good to know how you're going to respond to blood and guts and barf and things like that. So one aspect of clinical experience is the clinical environment and understanding the healthcare environment. There are lots of ways to get that through patient transport or volunteering to take care of, patients in a waiting room, or being a volunteer in a surgical ICU or some sort of capacity of healthcare. Some students are medical assistants or nursing assistants, and actually phlebotomy or other allied health professions roles that can get you into those settings. You can also think about clinical experience as understanding healthcare and the role of folks in healthcare in supporting health. So we have a health coaching program at UCR. Some of our health coaches are potentially not going to be able to meet with their patients in person. So they might be doing health coaching via a Zoom interface with some of their patients that are able to do it through their phones. They could do health coaching via text, for example. So there are other ways to think about how you could get some clinical experience or exposure to medical decision-making and patient interaction that might be virtual. And I would say we're gonna have to be creative here and figure out in what ways that's feasible in this new COVID world. And again, schools understand that there's been a deep restriction in auxiliary staff and volunteer staff in hospitals, especially during phase one when almost everybody got kicked out, including our third and fourth year med students, by the way. So we do understand how limited the experiences have been. And so some schools that have a requirement for in-person experience might be relaxing those potentially due to, the pandemic and what's going on. So, so the question of, I've taken classes in 2010, then I did some in 2011. Now I'm graduated in 2018. Now I'm taking a post-bac in 2021. So all these things go into my BCPM GPA. Yes, every course you've ever taken for college credit, including concurrent enrollment, will be included in your AMCAS GPA. So it will just show across the grid, freshman, sophomore, junior, senior, post-bac, which are any courses that are completed after your bachelor's degree is awarded, and then grad, which is a separate line that does not get added into your undergraduate GPA. So the courses do not expire for AMCAS purposes. They may expire for school-based purposes. So you would have to inquire at specific schools. Sometimes on their website, they might list, your courses need to not be more than 10 years old or something like that. That's less common now, but still might be the case. So I would definitely consider the courses to meet requirements, but also the courses are for your preparation en route to the MCAT and en route to being able to thrive as a first year medical student and beyond. So do a little bit of assessment about what you need, and then think about the requirements for the schools second to your own path and kind of what you need. Can letters be turned in after you submit your application? I have a letter that's taking longer than expected. Yes, so AMCAS submission and AMCAS letters are two separate processes. So you can certainly submit your AMCAS, get that ready for verification. Once your letters come through, they become available to schools. If you're worried about a letter that's taking a long time, I would try to get a backup letter. I think you can have a lot of letters in AMCAS. I want to say it's like 12 or some ridiculous number. But schools have a limit on the number that you can send. So you don't want to be, gathering letters willy-nilly, but I do think you can submit your AMCAS, and then if your letters come through at a later point, that's typically upon completion of your secondary that the letters come into play. Some schools want your letters to be in before they invite you to complete a secondary, but that's less common than just the secondary, and then the letters can catch up with the application. You typically do have to have your letters before your file goes into review though. So at some point, a lagging letter can delay your application even within the school's process. Do students that apply to schools, they've been rejected, have a disadvantage? So we do see on your AMCAS application, if you have previously sent a verified AMCAS application to us. So you're not a reapplicant unless you've previously sent your verified app to that school. So this year, if I applied to UCR and UCLA and that's all, and I was rejected from those schools, and next year I decide that I want to apply to UCR, UCLA, USC, and Irvine, I am a reapplicant at UCR and UCLA and a first-time applicant at USC and Irvine because it's only where you sent your verified AMCAS application. So an advantage to being a reapplicant is it shows that you're committed. It shows that you're continuing your path. You will potentially get to answer some specific questions about how you've grown, what's changed on your application. If you can't really speak to what's changed or how you've improved, I would really consider whether or not it's good to be reapplying and the timing of that. At the schools where you're a first-time applicant, you get one AMCAS essay. So I do recommend updating your AMCAS essay at least somewhat, but at schools where you've applied in the past, you definitely have to write new secondary essays, no exceptions, because we can pull up your application side by side from last year and see if you answered exactly the same thing. And it is a bit hypocritical, I fully admit, that we don't write new secondary questions, but we expect you guys to write new secondary essays. That's not fair, sorry, that's just the rules. A lot of times our committees just really like our questions. And so when we say like, we need to change them up, and they're like, well, we really like these ones. So trying to answer them in a different way, choose a different strength to feature, choose another experience to highlight, and maybe you're still answering the question about appealing to the school's mission. Maybe you're still gonna talk about your work at the free clinic, but you need to write a new essay to do that in order to show us that you're still very interested in our school in real time. If you're going through the motions, you easily give someone on the committee a loophole, to sort of go through the motions. So will you get greater attention from schools the following cycle? It depends. It depends on your candidacy and how you went. We don't really have, other schools besides that school don't have a way of knowing like where you were in candidacy. So in general, that process is sort of blind. Previous matriculation separated as a red flag similar to institutional action. Good question, yes. There is a box for if you're a previous matriculant, and that is, to be clear, a previous matriculant to a US medical school. So if you've gone to a different medical school, you may choose to disclose that or not. The transcript systems from those schools don't talk to the ones that are registered through the Federal Office of Education in the United States. So it's kind of a toss-up as to whether or not you'd want to submit those transcripts. I mean, that's kind of a specific case, but I would say per the AMCAS agreement, you're required to submit everything. But I do think that the scope of AMCAS is the United States. They don't review international transcripts. So if you go to an offshore school, you could make the feasible argument that that is an international school and it is not considered part of that. So if you've matriculated to a US medical school or DO school, yes, for the purposes of AMCAS, it will only list yes if you previously enrolled as a first-year student at an AMCAS participating school. So if a school says they don't accept previous matriculants, it potentially in their admissions process will catch it. So if you have a extending situation or something that you want to, explain, I would contact the school in advance and find out if your application will receive consideration. How does UCR look at students who are alumni? We have the HIDER program. So if you're a Riverside UCR alum, you will be considered in the HIDER pool. There's information about that on our website, but in general, we favor in our review process priority-wise, like we want to read applications first from people who are from inland Southern California, followed by Southern California, followed by the rest of California. So we have people that we accept every year from across the state, but we have a significant concentration of people because of our mission who are from inland, from the IE, and then Southern California as well. So in general, it's an advantage in terms of priority of your application and going for one of those 24 HIDER seats to be alum, but it's also becoming a much more competitive pool as well. When should you give up the cycle if you've been waitlisted? I definitely think at this point, if you get information from schools that their lists are not moving very much, very few offers are made in June, and even fewer offers are made in July, depending on what the start dates are. So I think it's good to just have your kind of two pathways and say, I obviously know that there might be an opportunity if I'm waitlisted, but I have to start preparing for next cycle so that you're not caught on your heels when the next cycle opens and not ready to reapply. Sorry, I'm scrolling and these are going quickly. Should you talk about institutional action that did not go in your transcript? For example, your clicker when you for giving someone your clicker when you miss class. If it is not on your transcript, but you were given a disciplinary action by your school, I think it kind of depends. Schools have different processes where some schools use restorative justice, where it's not through the official academic misconduct office. So I would find out from your pre-med advisor what the rules are there. But depending on what you decide to do, obviously you're bound to what the rules of the AMCAS application are. If your school's process is that you weren't subjected to an institutional action that's listed on your transcripts, the ones that get reported are dismissals. So through the federal register, if you're dismissed from an undergraduate institution or you have previous engagement with them and you don't list it as such, you could be subject to disciplinary action because of that. So I would seek help from your pre-med advisor or your conduct office, or contact the AMCAS helpline to find out about that. But in general, I always lean towards disclosure, but if you do feel like it's something minor, there was restorative justice approach for your school, it's not on your institution, it wasn't your institution's goal to put that as an official action. Again, there's still some ambiguity around institutional action. I read one the other day that was like, I had a candle in my dorm room or something. I was like, really? Like, we need to clarify what this means, because I think applicants are so like, I don't want to lie and I don't want to get in trouble, and so I have to say everything, but I don't care if you had a candle in your dorm room and you got in trouble. You got like I don't even know what you get. Do you get a ticket? Do you get a res hall ticket? I don't even know what that means. If you do it over and over and you have a constant, way of breaking the rules, I would assume there would be some greater institutional record of that at the school based on their process. So if you attended a non-degree granting post-bac program, you need to get a letter of recommendation. I took 2 classes. I do think that you have to choose people to be your letter writers who can advocate for you and go to bat for you. You have to choose people who know you well. So getting a letter from someone who you don't really think they can apprise your performance or speak to your potential in medicine might not be helpful. However, the most recent people who've taught you in the classroom, you don't want there to be a big gap where you have academic activity and you don't have letters to sort of back that up. So you might imply both and get one from someone that you think is strong, but just cover your bases and get one from one of the people who taught you in one of those classes. As long as it's not going to be like a negative letter, if it's going to be kind of neutral, it likely won't hurt your candidacy and might clear up some wondering or confusion on the part of the committee, but definitely need to have like a constellation of strong recommendations in your application to make sure that your candidacy is pushed forward. Is it bad luck to do post-bac and master's program? No. We have tons of post-bac and master's students in medicine. It's a very common pathway. We love our post-bac students. You do get a fresh line on your AMCAS application for your post-bac GPA and or graduate coursework. So it's a way that you can kind of almost get a clean slate, even though it doesn't change your cumulative GPA that much. We do see your most recent coursework in science and non-science in total across the post-bac and or graduate lines. Are you considered reapplicant if you sent the verified app but not completed the secondary? Yes, you are, because it's on your AMCAS application that we see that you've previously submitted your verified application to us as a school. So even if you withdrew, it will still show that you've sent your AMCAS, and the school can still pull up your previous AMCAS from the year before because they received your verified AMCAS application. They may know that you discontinued your candidacy, and they may know at which phase you withdrew and that you didn't submit your secondary. So depending on how the school might treat that, it would be school specific, but it is based on verified AMCAS in terms of it being listed on your AMCAS application. Can you speak how students who've been dismissed from med school due to academic failure, please share how students might, sorry, the scrolling is really bad on this. I'm trying to read and then it keeps moving. So if you've been previously dismissed and might overcome it and reapply, I think that's really challenging. There are very few schools that will consider reapplicants, and there has to be some really significant changes, and you certainly have to be well above any academic thresholds in order for a school to even consider sending again. I have worked with 2 students who were previous matrics who were able to get in again. One person had a very early onset mental illness and withdrew, and subsequent to diagnosis was getting treatment, was able to show, and actually was an academic high flyer, and that made sense to the committee, and the student was able to re-enter. The other student had an illness and was not advised that he could potentially take a leave, and was sort of questioning whether he really wanted to be a doctor given the magnitude of his illness, and then was able to recover and subsequently decided, you know what, he really did want to go back to medical school and was readmitted. Usually if you're dismissed for academic reasons, it is nearly impossible to get back in. So I would recommend pursuing another avenue in healthcare, an allied health professions program, or another graduate program in health science and other careers that are not clinically based or licensure based, like public health, epidemiology. We need really amazing people in all of those areas as well. I've had some students go into counseling, masters of counseling. We can kind of talk about routes that students potentially have taken. Some people have actually pursued careers in medical education as well. I actually work with a few folks who are MDs but not licensed physicians who love medical education and have just chosen to pursue that rather than careers in clinical medicine. So let's see. A supervisor wrote me a recommendation letter, so can I use that next cycle? You absolutely can. I would just recommend that you get an updated date on it. If you are a reapplicant, you do need to get new letters with new dates. They can be the same exact letter because obviously the person may not want to write anything different about you, but you do need to submit letters with fresh dates so that we don't think that they're stale. We want to make sure that those people still recommend you in real time. It's helpful even if the letter writers say, this person met with me, they weren't successful, I'm really still submitting them, I know they're a reapplicant. That can be helpful, but they don't have to edit the letter in any way. They can just update the date and resubmit it. In a mock interview through a university program, I got a question relating to protests. Since it's a sensitive subject, is that appropriate? Can I expect related questions as a Black student? This is a good question, Keandra, and maybe I'm not the best person to ask. Let me put on my conservative hat for a second. I am the dean who bought protest white coats for my med students. So I am like, get your ass out there and be loud, and we need to make some changes, right? Our school didn't want students to be protesting with their school logos because then you're representing the school in a political, and I was like, fine, we'll just buy white coats that are plain and we can have those. And so students borrow those when they go protest, and it works well. I do think that given what's going on, there might be a racist framework applied to Black students, expecting, and maybe it'll even be asked in a way that's meant to be supportive, but again, that is a racist framework to think that only Black students are being impacted by what's happening right now, and only Black students should be responding. As an interviewer, I would purposely be asking all of my non-Black students about that, because I want to know how proximal they are to anti-racist work themselves and how awake they are about what's going on in the world. I wouldn't be asking my Black students because I'm painfully aware that they're, you know, very immersed in what's going on some level. So I think that you should respond as authentically as you can, respectfully, but authentically, because ultimately, you know, everyone's like, I just want to get in, I want to get in, but you will be at that school for 4 years. And so I think you have to take yourself through a process of how much am I willing to tamp down, you know, for this admissions process, understanding that the person who's interviewing you is not the whole medical school, right? They're one gatekeeper. So they might be, you might get just a really crummy interviewer who's not very woke about that stuff, but the rest of the school, there might be great faculty in that school that can be supportive. So I think it's sort of a balance of being authentic, but also understanding a little bit of the game of getting in. And as long as it's a school that you think you can thrive, where you will not be further oppressed for your Blackness, I would, you know, respond as affirmatively as possible and try to hit on areas of overlap, of common ground around racism as a public health issue. You know, it's very important. And if you know of specific examples in healthcare, like white coats for Black lives and these types of things, that can also be really helpful. I would hope that interviewers wouldn't discriminate against what someone's opinion or position might be, but how knowledgeable they are, how well they're able to really talk about those issues. And I think this is an instance where if you get a question like that and you feel that it's unfair, you could reach out to the admissions committee or the admissions office and just say, you know, I'm not sure if this is part of the protocol. I was fine answering this question, but I do want you to know that I was asked a specific question about, you know, my involvement with this movement. And, you know, because if you're being asked that question, everybody else should be being asked that question as well, especially, you know, non-Black students. So that's a good question. Does the commit to enroll deadline cause movement typically? Unfortunately, the commit to enroll deadline on April 30th causes some movement. And then beyond that, now we're on school specific deadlines. So some schools have a June 1, June 15th, July 1st. The latest a school can put its commit to enroll deadline is 3 weeks before orientation. So getting into July is where you're going to start seeing if there is any movement, but I'm not sure how many multiple seats are being held at this point. Usually at this point, it's only a couple hundred people who haven't made decisions across the 21,000 seats that are available. So very little movement in June and July typically. How does the UCR flag work for applicants? So it works off the county fields in the AMCAS application. So you put your childhood county, your current address, your permanent address, where you go to school. So there's various flags that are counties in the United States. So we use San Bernardino, Riverside, and Imperial County. We also use it for your participation in our pipeline programs on our secondary. So if you mark any of those, it creates another flag that you've participated in one of our programs, because that helps us understand that you at least know something about us beyond just our website. So if you've participated in Future Physician Leaders or Medical Scholars or our post-bac program, or you've been an EAP applicant, for example, you mark that on our program inventory on our secondary, and that creates a flag as well. So that's sort of just how we do it. And I think there's a the flags are sorted from highest to lowest. So born in Riverside, grew up in Riverside. Oh, and high school too. So we have a county flag for the high school that you've attended as well. So that kind of helps us approximate someone's, ties to the area through the AMCAS data. Do medical schools offer conditional acceptances? We will offer UC. Some schools have what they call bridge programs where I know UIC has one, Georgetown has one that's called Georgetown GEMS, where you do the first year of medical school over 2 years. So it's a decelerated curriculum, and if you do well after year one, you sort of get your seat and you get to go into the second half of year one, and then you're in medical school just for good. UCR had a conditional admit program where we would look at applicants who had previously applied, and if they were just right there, but we wanted them to take additional classes, or we wanted them to take coursework and then repeat their MCAT, if they got a certain score, they'd be a conditional admit. But it's really case by case, school by school, and those are less advertised and less well known. I've not seen them tied to MPH programs. A few of them might be tied to MS programs. So I would explore if a preparation with a conditional admit is an option. I would contact specific schools about that. Is there a way to prep for secondaries? Yes, so you can go on studentdoctor.net and look up the secondary questions. Students typically post them as soon as secondaries are released from various schools, and you can try to work on the essays in advance. You can also just write general essays about various topics. You're probably going to be asked about diversity in some way, shape, or form. You're probably going to be asked about growth. You're probably going to be asked about failure, hardship, asked about your mission, what your goals are, role models. So, kind of similar to what interview questions typically are. It's good to just catalog your experiences maybe and think about ways that you could use those experiences to talk about different topic areas such as, growth, career goals, things like that. So I would recommend using a Google Docs file, and then you can just keep creating, different iterations of some essay stems that you might be reading. And I put some of these things in my book as well, like general areas of questions that you'll be asked about, but it's growth and grit and, some of the more common questions that people will be asked in an interpersonal interview on the secondary. And typically, I don't think student doctor is good for much, but it is good for knowing what the secondary questions are, because people usually do post them as soon as they get an invitation. So, all right, any further questions, crew? Awesome. So I will be back next month. I'll leave the forum open. If you have other questions that you want to submit just for the forum, feel free to invite any other pre-meds that you think are looking for support. And I'm just here. I'm encouraging all of you. I'm like virtual hugs and fist bumps and all that on your way. And I'm just glad to see so many students here for this first one. And I look forward to checking in with all of you next month. Thanks.